People with alcohol problems in England are less than half as likely to get the right help than elsewhere in Britain, according to a new study. King's College London has found that Scotland and Wales have both invested in their alcohol services. But in England, over the past 7 years, there's been a significant cut. Well, our correspondent Michael Buchanan is here with me now. Michael, tell us more about this study and what it found.
Well, essentially what the researchers are saying is that it is a national epidemic of alcohol-related problems in the UK. They say there are 1.2 million hospital-based admissions because of alcohol problems each year. That is a figure that has been rising by about 17% in England over the past decade or so. 1 in 10 of all hospital admissions are because people are dependent on alcohol. But as you said, while Scotland and Wales have invested in these services in recent years, what the researchers say is that services in England have been cut by more than £100 million. And the consequence of that is that the gap between the availability of support for people in England and the rest of Britain has increased markedly. Now that has meant, for instance, in England, that community specialist support have been cut by more than a fifth. Inpatient detox services cut in half, they say, and the researchers say that these cuts simply do not make any sense.
The services that are being cut have a strong evidence base of effectiveness and cost effectiveness. So for every £1 you spend on treatment, you save over £3 in NHS and social care costs. So really cutting these services is a false economy.
So what have the services who have been criticised been saying?
Well, it's basically to do with public health budgets in England. They are the responsibility of local councils, and the body that represents local councils say this: look, all our budgets have been cut and we are doing what we can. Our overall budgets have been cut by billions since 2010. Our public health budgets have been cut by 700 million since 2015, and we're being asked to deal with increasing and new patients, often with complex care, and they want the government to pour money into these services in the upcoming spending review. NHS England, which looks after the hospitals, is going to invest in 50 alcohol care teams, in hospital teams that will look after patients while they're within the NHS. Now, the researchers say this is a really good idea. They argue that they could arguably be pushed to every hospital, but they say there's no point in investing in what they describe as Rolls-Royce service within hospitals if you are in the community basically facing a Robert Reliant with a flat tire, if there's nowhere for these people to go to give them that specialist support they need once they leave hospital.
OK, Michael, many thanks. The time is 18 minutes past 1. Our top story this lunchtime.